Hello and welcome to your daily COVID-19 update for today, Thursday, August 18, 2022.
So over the last 24 hours, we had 41 new cases. We're now tracking 457 cases across the country. These are active cases. In terms of hospitalization, we currently have 14 persons who are in hospitals, 9 of whom are in the Ocean View Hospital, with 2 of those persons in the ICU. I think one of the reasons that we've been hearing is that people are fatigued. They have been at this for 2 years or more, and they don't want to wear masks. They just want to move around and be free. But there's a consequence to that because we are still in a pandemic. We have had in Guyana so far 70,703 cases since the 11th of March 2020 when we had our first case. So from then to now, we've had 70,703 cases. Of those, we had 1,276 persons that died. So that's quite significant. And while we work very hard to make sure that can save as many persons, it would really help if persons get vaccinated, because many of the persons who came into the hospital, especially in the early days, they did not, when vaccines were available, they were not vaccinated. And we continue to see that trend where persons who are unvaccinated or persons whose boosters are due and they have all kinds of comorbidities, they're the ones who are coming in to the hospital. So it would really make a difference if persons really and seriously go out, make sure they get their booster doses, because it would protect them. And we have been saying this repeatedly, but unfortunately, a lot of people who really need to get their booster shots are not showing up. In quite a few countries, there have been a resurgence, and that's because there is a new, there is the BA.5 variant that is causing a lot more infection because it's more transmissible. There's also the emergence of newer subvariants of Omicron. So we have to see how those would behave. There's a BA 4.75 that is emerging, and there's another one that was predominantly in India, I think BA 2.75 or something like that. So these are new variants or subvariants that are emerging. We don't know how they would behave. We don't know whether they'll be more transmissible, whether it'll cause more severe disease. These are all new things. Or maybe they just wouldn't become widespread. So these are very early days, and we'll have to see the dynamics of these newer things that are emerging. They can, depending on what the doctors are seeing there, they can get baricitinib, which is one of the medications that have been very effective against COVID. They can also receive remdesivir, which is an antiviral medication. So these are 2 meds that we have and we have been using, and we've gotten very good results. We have been working to acquire monoclonal antibodies because this would help patients who really need to boost their antibodies level. And we have placed an order with PAHO to acquire monoclonal antibodies. So once that becomes available through PAHO, it would be available to our patients. But a lot of it has to do with what symptom they're having. And once we know that, then we'll treat accordingly. Well, unfortunately, if we don't have high uptake, we are going to get some of the vaccines expiring. Um, we don't want that to happen, and therefore we are encouraging people to make sure they come and get vaccinated. Again, with vaccines, they'll protect you, they'll save a life, and therefore people really need to understand the importance of doing this. We do have um, Pfizer that is available to persons who want to get boosters, or if at this stage they're even coming for their first dose. We have the Pfizer vaccine, which is available. We also have Moderna that is available. We have Sinopharm vaccines that are available. For the adults, we have 445,650 doses that were administered. That's about 86.9% of our adult population receiving a first dose vaccine. Second dose, we are at 345,342 doses. That's 67.3% of the population receiving a second dose. In terms of the 12 to 17 age group, we have administered 35,523 doses. That's 48.7% of that age cohort, and second dose would be 26,028 doses, or 35.7% of that age cohort. In terms of the 5 to 11, we have now completed, or we have administered 7,581 doses. That's 7.4% of that population. And second dose would be 2,730 doses, or 2.7% of that age cohort. Boosters, right now we are at 72,009 doses, so we continue to advocate for people to get their booster doses.
You have been watching the daily COVID-19 update for today, Thursday, August 18, 2022. I'm Natasha Smith-Thomas. Goodbye.